Well, Dr. Amesh Adalja joins us for more on the coronavirus. He's a senior scholar at the Johns Hopkins Center for Health Security, and he's in Pittsburgh. Dr. Adalja, good morning.
Hi, thanks for having me.
So you're an expert on infectious diseases, also pandemic preparedness. How do we get this under control as you see all of these rising cases and hospitalizations?
Right now, we have a pandemic that is completely out of control. And the reason it's out of control is we still don't have the public health infrastructure to test, trace, and isolate. And without that, people can't know their status. They go about their lives and they infect other people. You saw that long line at Dodger Stadium that you showed. We can't have testing lines like that. We have to be able to test ourselves almost on a daily basis, maybe even at home. We brush our teeth, test ourselves, and know what we can do that day. We can't do in November in the United States what Taiwan, South Korea could do in March. So this really is the reason why we're seeing these surges. And then you have pandemic fatigue on top of that. So it's really a conglomeration of activities, but it's still, we can't do the basics in public health in this country.
Doctor, how worried are you right now about Thanksgiving and the pandemic?
It's almost inevitable that we're going to see increasing cases after Thanksgiving. Many people are traveling. I've seen pictures of crowded airports. Most people are not modifying their arrangements. So this is going to be a place where people are going to let their guards down, and we're going to see transmission. The epidemiology is changing. We're not seeing people get infected so much in restaurants anymore. They're getting infected around their own dining tables. So this is something we really have to help people understand, that there is risk there and that you cannot let your guard down, and you have to take some common sense precautions even in your own home when you're inviting people from other households there.
Earlier this week, we saw in New York City, the largest school district in the country, shut down in-person learning. And you wrote in an op-ed in the Washington Post that this was the wrong move. You were not alone in this belief. What do you think school districts should do going forward?
It's a very difficult situation because, paradoxically, children tend to be spared and they don't necessarily accelerate the transmission of this infection the way they do, for example, with influenza. And the data that we're seeing is that people, when they're in school, when they're in the classroom, that's not driving infections. It's very, very low. So I do think the priority has to be, the default has to be, keeping schools open. And that's what Europe is doing. They may shut other things down, but they keep schools going. I think we have to put more priority on education in this country than we have.
Amesh, you spoke to Business Insider regarding both Pfizer and Moderna's vaccine, saying that they are very similar. The key will be distribution. And I'm curious to know, what are some of the challenges around distribution in both of these cases?
When it comes to the Pfizer vaccine, it's something that requires storage at a very cold temperature, -70 centigrade. That's not easy to do, and that's going to make it much harder to get that into the arms of Americans. So we have to really think about how we're going to turn this vaccine into a vaccination, and it's going to require a lot of planning in all 50 states to make sure that people have access to this. And that's something we're already starting to do, but it's going to have to accelerate very rapidly because it's going to be one of the biggest public health challenges. The Moderna vaccine doesn't require storage, but it's still a big endeavor to try and mobilize that much vaccine that quickly. And remember, these are 2-dose vaccines, so that's like 600 million doses. So this is something we've never done before, and we really have to make sure we get it right. There's going to be hiccups, but until we get the vaccine into people's arms, we're going to continue to still be in this pandemic limbo.
But aren't there also concerns as to who the vaccine will get to? Some of the rural and urban communities may not have the access that's necessary.
This is going to be a major issue to ensure that it's equitably distributed, that all parts of this country get it. There's going to be priority groups that are set by the CDC and an advisory committee. Likely healthcare workers, high-risk individuals are going to be first, and then it's going to start to move to average-risk individuals. But we have to make sure, especially when we're talking about a vaccine that needs extreme cold storage, that we have the capacity to keep that vaccine in places where they don't necessarily have those freezers. So there are companies, for example, UPS is building freezer farms so that they can distribute from those freezer farms the vaccine. So like I said, this is going to be something that requires a lot of coordination, and I think it's going to be something that's going to be very difficult even in the best of times.
Dr. Adalja, thank you.